When I was first thinking about getting trained in the LANAP protocol, my boss at the time had used it for years, and he had a really good experience with treating patients with LANAP. He said that it was a way where patients that were scared about having surgery done the traditional way could do it without the fear of what was associated with the traditional method. And because of his experience and his recommendations, that's how I ended up pursuing the LANAP training. In order to treat gum disease, traditionally we would have to perform periodontal surgery, which involves having to cut the gums and remove all that bacteria that's initiating that disease in your mouth. But now with the LANAP protocol, we are able to do it without using any scalpels or any stitches, and we can actually get down under the gums and eliminate the bacteria that's responsible for causing this disease in your mouth. I've run into a lot of patients that have had traditional periodontal surgery, or that have had friends that or family members that have had that done, and a lot of them are traditionally very scared and terrified to go through that process. But with the laser, the LANAP protocol as an option, it tends to remove a lot of the fear and the anxiety that is usually associated with having that surgery done, and it kind of eliminates that barrier for a lot of patients. I find that case acceptance really goes up. There was one patient I treated a couple weeks ago, actually, and when he first came, it was the third dentist that he visited to get another opinion, and he came with a lot of fear. He was told that he had to remove all of his teeth, and he was just looking for another option, and he heard the same message that he needed all his teeth removed twice already before he came to see me. And this was a way that we can treat someone who was not only fearful, but had received opinions that his teeth could not be saved. I remember the patient reacted as if what I was telling him was too good to be true, because he had received two other opinions saying that he had to lose all of his teeth, he had to get dentures, and to be able to maintain those teeth and save them and not have to go through surgery to do it. He was blown away. It was very satisfying to be able to reach someone who thought that they had no chance and no hope, and to give them an option that didn't involve tapping into their fears over either losing their teeth or having traditional surgery done. That was a very fulfilling feeling, and the patient was very, very grateful, and it really made me a believer in the LANAP protocol.